People always talk about hospital care and how it skyrockets, but what they don't understand is we're paid on a DRG basis. You walk in the door with a diagnosis and we're paid a set amount of money. Now, if we take care of you and you're Joe Blow patient and wonderful and get out of here in that 3 days that you're supposed to get out of, we might break even on you, maybe. But if anything happens along that way and we can't get you out for various reasons, homeless, further infections, etc., it's a money loss from day one. The problem I run into is my door ends to a certain degree, and then now I have to go the next step and send them out somewhere. All those institutions that are out there can pick and choose. They can pick and choose if you have insurance and don't have insurance. I can't pick and choose. What we really need to do is put more dollars towards that next setting, whether it's home, whether it's a stopgap of some type of a shelter that can take care of these patients, whether it's just general support for family members so they can take those people home. There's really very few resources, even for the insured.
Two of our guests, who I assume you're going to be interviewing, had some very, very serious health issues, and post-hospitalization, they were just let out on the street. And I was frankly appalled by this. It didn't take long for them to have to be re-hospitalized because of reinfection. And this time I went and spoke to the case manager and said, you cannot let these people back on the street. They're too sick. You know, they're at very high risk of reinfecting. And they assured me, oh, they would be placed. They would certainly be placed. But they weren't placed. Both of them wound up on the street once again, and once again were rehospitalized because of reinfection. It is a vicious, vicious cycle, and I think it's very expensive for the taxpayer. It's extremely expensive for the hospital, and it's very, very expensive for our guests who are very ill and deserve some compassionate care.
The one time I was released, they gave me a matter of hours, which I couldn't believe. They finally found out that I'm a veteran, and the veterans wouldn't help me because I haven't been in contact with them for a while. And they said, so you're going to have to go. And I says, well, when, now or tomorrow morning? And he says, no, now. So I had a matter of hours to get out.
And then where did you go?
Back on it. Well, I went to Center Stage, I believe it was. And later that night, the warming center.
Yeah, there was a problem with that because I informed them that I had nowhere to go. And so they suggested going to a shelter, and I says, well, that's what I'm doing right now. I, spend the night at the warming shelter, and then during the day I go over to Center Stage, which is a banquet hall. And Mr. Coleman lets homeless people stay there during the day so we're not out on the street freezing. And they just said, well, okay, that's fine as long as you have somewhere to go. I left the hospital, and about 4 days later, my right foot has been amputated completely except for my heel. And it had a huge wound that they had stitched up, and they told me I had to be very careful with it. Well, of course, the bathrooms have a lot of germs on the floor and whatever, and my bandages got a little wet naturally from the snow, and there was a couple steps that I had to kind of crawl up, so. And I think it was mainly from probably the germs off the floor in the bathroom. I got what they call mercs, I believe, something like that. It's an extremely bad viral infection. And so about a week later, I had to go back into emergency again. And my right foot was in terrible shape. And again, I had the red streak going up. And initially, they were saying if they couldn't heal it, they might have to amputate me from the knee down. I mean, it was that serious. But I was in there for another 2 weeks, and they pumped me full of antibiotics, and they did get rid of the infection. And so they took care of it. So once again, I was impressed because they didn't just like kick me out. They made sure that they took care of it and everything. And since then, it's been healing well.
When you're talking about the two gentlemen that brought us together, this is an example of some of the types of things that we do to try to not get them back, because we want them in a state of health also.
I really think that I was released too early, for one thing, because my foot was in a very shaky state at that time when I was released. And I really think that I should have had some kind of like a rehab facility with a bed and a nurse there that maybe could have monitored it and looked at my bandages and stuff, and it might have avoided that infection. So I was concerned about that when they put me back out on the street. Well, I was kind of upset about that because, you know, I had heard that usually they have some kind of a rehab facility that you can go, and I didn't feel that I was healed up enough yet, you know, to be put back out like that. So I was kind of upset about that.
We close at 7 a.m. We open back up at 7:30 in the evening, and we are not. We have no way of facilitating any kind of care with during the day.
We sleep on the floor. We lay out blankets, but there's no bunks right now.
I hate to see someone else go through what we've gone through.
So that's where the gap truly is in our healthcare system. It's not only providing the care and the money losses that the hospitals take, but it's also that second level.
Nurse Marianne Ryan agrees.
The one thing I really would change about the system is providing long-term care, post-hospitalization, to ensure that people would get well. And I understand that's a big glitch in the system right now. You have to be able to receive rehabilitation services to get into a nursing home. And I don't care how rich or poor you are, if you don't need rehabilitation, you're not going to be taken into a nursing home. And there's only a certain number of days that you are given in the hospital setting with a diagnosis. And if you have any complications after that, well, that's too bad. You have to deal with that when you go home and come back into the hospital or go to receive whatever services you need. What we really, really need, especially for our population, is we need cheap post-hospitalization medical services that's just going to maintain them in a safe setting so that they will be provided food and shelter with a minimum of care. And I think that could be done.
When we talk about nursing homes and second levels of care, if anybody ever made phone calls and knew what these types of cares cost and what insurance companies will pay, it's very frightening at times. You talk about you and I. You'd be very difficult to afford a lot of this if you didn't have. You have to have the disease entity that's going to fit, that coverage is going to cover.
Urban hospitals like POH try to do their best to fill these service gaps, providing some outpatient care.
It's immediately depressing for us because I can set up a cab voucher to come from a homeless shelter to this clinic in the dead of winter, which I do. I have cab vouchers that I give out on a routine basis. I can set up my nurses in there, and even though the clinic's only open 5 days a week, those other 2 days, Saturday and Sunday, they go to the emergency room for the treatment. So it's 7 days. The problem is many of these people do not follow up. They don't come.
But sometimes getting to healthcare services is as much of a problem as the convoluted system itself. With Gary and Jim, their amputation seriously limited their mobility. It is hard to navigate a wheelchair through the deep snow of unshoveled sidewalks in 20-degree weather.
And they noticed I was getting worse again, so they hospitalized me again. I was in and out 5 different times. And then there's a nurse at the warming center that looks after us once a week or so. And she's very concerned about us.
But a medical issue doesn't have to be as catastrophic as an amputation from frostbite to be problematic for those who are uninsured and seeking health care.
Well, it's getting treated to begin with, to find a doctor who will consistently treat them. And we had one person that came here that was being seen at a clinic, and he was being very successful, and all of a sudden he got insurance, and the clinic said, you can't come here anymore. So then he didn't know where to go. So then we had to send him to another clinic that was supposed to see the homeless, even though he had insurance, and they refused him services. So then we had to call them and say, but this is one of our homeless people, you said that you would see them, and finally he got seen. But that's really pretty frustrating for people that may have some disabilities in the area of tracking or making appointments or being compliant. Prescriptions is a terrible problem. I have yet to be able to find places that will provide for our people with prescriptions. So we are now going to have to go to some pharmacies and see if we can have an arrangement made so that we can at least be paying for some of these prescriptions through copays. Because otherwise, they walk around with their prescriptions and nobody fills them.
They come to us, and hopefully, you know, they're trying to find a place to go. We have referred them to the resources that we know. Sometimes it works out, and then sometimes it does not. And we're finding that the health care is what they really, really need.
Clinics will see patients and will provide the medication for their clientele. But as I said, that's a very limited group of people, and it takes an awful long time for them sometimes to get appointments, as I said, up to 6 weeks for some of these clinics.
If there's not resources, there is no answer for that. It falls on the family. And how many times we talk about families that are bankrupted over a catastrophic illness?
So how do you measure the value of a life? With 1 out of 6 Americans under age 65 uninsured and without access to adequate health care, the measurement of a person without health insurance includes a life potentially shortened and poorer health during that lifetime. It is too easy for us to dismiss the uninsured as being broken and therefore deserving of being thrown away. Yet, with the one precious life that each of us gets, the question becomes, what would we want if we were uninsured and in need of medical care?
$10 million contract, one player signed, was the top of the news. He laughed as he stood looking at his broken down shoes.